The idea for the clinic was that the students wanted to connect with the community better, and knowing that the number of uninsured in East Harlem was pronounced, the students came up with the idea of developing a free clinic that would offer primary and preventative services to our community. East Harlem has such a large proportion of uninsured patients. There certainly was a community need for a free clinic. What the clinic really does offer is an opportunity for medical students to understand the plight of the uninsured, to help navigate the healthcare process or the healthcare needs of a population which is incredibly disadvantaged, and really to understand what those needs are, which they cannot understand in very brief interactions in the hospital.
In medical school and in medical education, there is a large focus on diseases, as it should be. There's a large focus on what are these diseases, how do we treat them, what are the indications for treating them, etc. But there isn't as much indication on, in a resource-poor setting, how do you utilize your knowledge and take care of patients when you don't have a ton of money.
The medications on our formulary are researched by our medical students to determine cost effectiveness. There are certain medications that we will not pay for because they're either cosmetic or there's a better alternative. And what I mean by better is that it's effective but also not as costly as some other medications. Medical students really have to think about what they're prescribing. And so what we're really teaching medical students at the East Harlem Health Outreach Partnership is how to modify their prescribing practices so that they don't just have knee-jerk reactions that are based on what they've seen fellow physicians prescribe. They're really sort of understanding what is the most cost-effective alternative or cost-effective medications that they can prescribe for a certain disease. I believe our clinic offers invaluable lessons for medical students in terms of how to deliver the best care in a collaborative way, but also deliver it while saving money. And this is really key, particularly in the arena of healthcare reform that's currently underway. It is crucial for our medical students to really understand how to service patients without breaking the bank.
The knowledge about cost savings is an enormous lesson, because when you, as the clinician, as the doctor, are thinking about how much every drug costs, how much every CT scan costs, it's not always a good thing, but it definitely has its merits, and those merits are really understanding if you need it. Do I need this test? Do I need this expensive drug, or can the generic do just as good of a job for 1/10 of the price?
Medical students are not going to understand how to offer the best medical care when resources are limited in practices where expenditures and cost savings is not really stressed.